Just over 6 weeks ago now, I posted a video talking about something that had been bothering me. That something was the Australian 2022 COVID death toll. Well, we're officially 3 months into 2022 and nothing's changed. The media has moved on, the government's moved on, and people have moved on. The only thing that hasn't moved on is COVID. And it's still with us, and it's still causing death, longer-term illness and pain for many people. Here is a very simple fact. In 2020 and 2021 combined, there were a total of 2,239 COVID deaths in Australia. In the first 3 months of 2022, there have been 3,755 COVID deaths in Australia. The 2022 figure is almost definitely underreported when you consider the fact that it doesn't include the more than 300 deaths that had gone unreported in New South Wales but had only recently just popped up. Okay, so those are the facts, and they're the numbers. Not that you really hear about it these days in the media. Now I'll address a couple of points that came out in the comments after the last video. It was a bit weird. The last video was probably the least popular video I've ever put out. So if I was just trying to be popular, I probably wouldn't put this video out either. But anyway, there seems to be a disturbing number of people that when they're presented with the death toll, like to think that somehow people are dying of all sorts of other random things, unrelated to COVID, and they just happened to have COVID when they died. This idea that people are dying from other things but are still being reported as COVID deaths has been doing the rounds for quite a while now. The whole idea has been debunked a number of times now, but in case you've missed them, here are a couple of sources that should clarify things. So there's this via the AAP fact checkers, where the Department of Health confirmed that states and territories only reported COVID-19 deaths to the National Notifiable Disease Surveillance System, where they considered COVID-19 the primary or contributing cause of death. The day I released the last video, the Australian Bureau of Statistics released their own COVID-19 Mortality in Australia report. It's important to note that the ABS report only included deaths recorded in the civil registration system. So that's the various registries of births, deaths and marriages. And as the ABS note, the data is not directly comparable with data sourced from health surveillance systems. With that caveat out of the way, here's the key takeaway from the ABS report. Of the 2,639 deaths recorded at the time by the ABS, 2,556 of these were classified as directly due to COVID-19. The key words there are directly due to COVID-19. Or to put it another way, approximately 97% of COVID-19 deaths that have been reported to the ABS, so those finalised through the states and territories registries of births, deaths and marriages, 97% of deaths were shown to be directly caused by COVID-19. The remaining 83 deaths, or approximately 3%, died of other causes, but they just so happened to have COVID at the time. So to say it again, 97% of the deaths were reported as being directly due to COVID-19. The other thing is people will see charts like this one and immediately jump to the conclusion that the majority of people that have been reported as dying of COVID have died from something else, like pneumonia. This is forgetting that COVID leads to things like pneumonia. Here's a nice quick explainer, but I'll leave a link to the full video in the description.
Now, COVID causes pneumonia and acute respiratory distress syndrome. That's the main way it kills people. That's honestly like saying it doesn't hurt when I pee because of bacteria, it hurts when I pee because I have a UTI. The bacteria cause the UTI, just like COVID causes pneumonia and acute respiratory distress syndrome.
The term pre-existing health conditions gets thrown around a lot. I guess it gives people some degree of comfort. They may feel they are relatively fit and relatively healthy, so COVID's not going to impact them. People will also use it to falsely rationalise what's going on, suggesting that, these are people that were going to die anyway. Now, besides the absolute callousness in that thinking, let's take a look at some of the pre-existing health conditions to understand why dismissing the deaths of those with pre-existing conditions is just absolute garbage. Let's start with the big one, obesity. 67% of Australians aged 18 and over are either overweight or obese. Anyone with a body mass index of 30 or more classifies as obese. So approximately 31% of Australians meet that definition. Diabetes. There are approximately 5% or 1.2 million Australians that have diabetes based on ABS data. This does not include up to 500,000 Australians who are thought to have undiagnosed type 2 diabetes. Hypertension. Approximately 11% or 2.6 million Australians reported hypertension according to the ABS data. Approximately 11% of Australians also have asthma based on ABS data. Chronic obstructive pulmonary disease. That impacts around 1 in 20 Australians aged over 45 according to the ABS. Chronic sinusitis is one of the most common primary care presentations in Australia, and 1.4 in every 100 general practice encounters were due to acute or chronic sinusitis. It's important to note that that wasn't the entire list of pre-existing conditions, just some of the more common. But as you can probably tell, the reality is, if you don't have one of those pre-existing chronic conditions, then statistically someone you know or someone close to you will. What am I saying? Don't try and argue that the deaths of those with underlying health conditions shouldn't count. Just stop and follow one simple rule. Don't be a dick. It's the same with age. There'll be people that will look at the average age of COVID deaths and use that as a way to dismiss the data. But I think that's garbage, and it seems to be built on the belief that an older person is more expendable. A person's age should not diminish their life or their death. My personal view is one that aligns with the World Health Organization, and that is society is measured by how it cares for its elderly citizens. One thing that the pandemic has shown us is that Australian society has failed at many levels.
A Royal Commission has been stinging in its criticism of how our elderly are being protected from the virus, exposing unforgivable failures of both the state and federal governments.
While there was undoubtedly a great deal done to prepare the Australian health sector more generally for the pandemic, the evidence will reveal that neither the Commonwealth Department of Health nor the aged care regulator developed a COVID-19 plan specifically for the aged care sector.
The Commission heard that the COVID pandemic has exposed the flaws in the aged care sector, and that given those deficiencies, it's hardly surprising that it's struggled to respond to the biggest challenge it's ever faced.
There have been suggestions that we should somehow sacrifice our elderly Australians to the virus in a bid to keep our economy open, an extreme view that incensed the Prime Minister.
That is just a hideous thought. Aged care is the government's responsibility.
If you're one of the people that writes off the deaths of older people as a small price to pay for being able to do whatever you like, I don't think there's anything I can say that's going to change your view. But I do have a question. How old does someone have to be before you're comfortable throwing them to the wolves? 60? 70? 80? Again, don't try and dismiss the deaths of older people as things that shouldn't count. Just stop and follow the simple rule. Don't be a dick. Whenever COVID is mentioned in the media these days, for some reason the response to COVID is being pitched as a binary thing. And it doesn't have to be that way. It doesn't have to be all or nothing. And the reality is there's more that we could all be doing to stop the virus spreading and killing people. But it just seems a tad too inconvenient for society. People like to roll out the car crash analogy, which goes something like,
people die on the roads all the time and we don't ban cars.
It's true, we don't ban cars, but we do have in place a number of interventions to try and keep the road toll as low as possible. Speed limits, drink driving laws, seatbelts, safety features, road rules, infrastructure. But when you think about COVID though, making people wear a mask while going to the supermarket is just a bridge too far. As we head into a federal election campaign, neither major party is going to want to address the elephant in the room. And that elephant is that COVID is still with us. It hasn't gone away, and it continues to kill Australians in record numbers. Inconvenience is a campaign killer, but so too could be COVID. But only if you talk about it. Over 4,000 COVID deaths in Australia in the first 3 months of 2022. Almost double the number of deaths from the first 2 years of the pandemic combined. Let that sink in.